Peer Learning Exchange is a webinar or monthly call with topics focused on promoting health equity and eliminating disparities in child, youth, and young adult behavioral health. Topics are generated by you, individuals working in, being served by, or partnering with behavioral health organizations and system of care, states, communities, tribes, and territories. The TIA Network, as it's known, is part of the National Training and Technical Assistance Center for Children's Behavioral Health for the Substance Abuse and Mental Health Services Administration, commonly known as SOC. My name is Linda Callejas, and I'm an assistant professor at the University of South Florida and director of the Cultural and Linguistic Competence team of the TIA Network. Today's webinar is titled Human Resources and Workforce Development Strategies to Enhance and Expand Cultural and Linguistic Competence in Systems of Care. Our discussion today will focus on aligning organizational culture with system of care values and principles, with specific attention paid to developing staffing plans for recruitment, hiring, promotion, and retention of a competent and diverse workforce. I'm excited to welcome our experts today who will be leading this important discussion. They include Peter Gamache, a key partner of our TA team with the TA Network, James Flournoy with the Colorado Office of Behavioral Health, and Shannon Moreno, Mental Health Equity Coordinator at the University of Texas, Austin. They'll each introduce themselves and the work that they do shortly. Before I turn things over to Peter, I just want to remind everyone that this presentation is being recorded and your lines will therefore remain muted to help eliminate any background noise. So we encourage you to use the chat box to type in any questions or comments during the presentation, and we'll work to address these, especially at the end during the Q&A session. Under the public chat box where you can comment, you'll also see you should see a box labeled Files that includes a downloadable copy of the PowerPoint being used for this webinar. And just a final note, please stay on with us a few minutes once the webinar ends to make sure that you're able to complete the evaluation that will automatically appear upon its conclusion. And now I'll turn the discussion over to Peter.
Thank you, Linda. Thank you, everyone. It's great to connect with you today. Just in terms of timing for us on our Thursday afternoon together, it's about 1:30 Eastern Standard Time right now, and we're planning to go until about 2:30, about approximately an hour, and then we'll have a question and answer session in terms of dialogue that we can have together to identify any opportunities for us to really specifically talk about items and other types of things that are most of interest to you. So it's great to connect today, and we have three major learning objectives, overarching learning objectives today. The first is to identify the rationales for ensuring cultural and linguistic competence within systems of care. And then we have the second learning objective, which is to understand strategies and approaches for building cultural and linguistic competency. And our third objective is to learn about equal employment opportunity and non-discrimination protections. So these are the overarching learning objectives for us. So the first thing we want to do is to have an interactive component here to where we can sort of respond to a poll question, because we're very curious to know whether your organization uses a formal strategic planning process for workforce development. And workforce development is the overarching term that encompasses trainings, that encompasses everything that would, an HR department would be connected to. So whether your organization, as you know it, is using a formal strategic planning process for workforce development. And we'll just give about 5 to 10 seconds for everyone to click through. Okay, so as those are coming in, it looks like the vast majority of you do have a formal strategic planning process for workforce development, which is excellent. We do know that, with organizations, there are lots of competing priorities. There's lots of, activities on a day-to-day basis. And if there isn't a sort of formal type of process in place for workforce development, it can kind of, go into a sort of ad hoc or sort of general approach to ensuring that trainings are updated, that people are receiving the trainings that they need, and that there's an ongoing emphasis on that. So that's really excellent. Okay, and we're just loading back for just a moment into the presentation. There it is. Excellent. So that is a wonderful, wonderful thing to know for us, and will inform our discussion today. So why is it important that we're looking at it through the HR and workforce development lens, and how cultural linguistic competence is connected to that? Well, because if we look at some core definitions, we can start to see the the real connection points. It's always important to kind of revisit definitions and define terms. So the first one is what is cultural competency, and it's the ability to interact effectively with people with different cultures, and it also helps to ensure that the needs of all community members are addressed. So certainly an HR department or an HR and workforce development function of a system of care would certainly relate to the need for ensuring cultural competence. And then diversity is defined, it can be defined in many different ways depending on the context. There are intersectional identities. There are lots of overlapping and intersecting cultural ways that people are identifying and affiliating. So we really need to consider the broad spectrum of what diversity really means from a system of care perspective. And so it is depending on the context. There are, for example, majority-minority communities, right, where there may be a minority community that is in a minority group in the United States overall, but in certain areas maybe a majority population. So what does that mean for example, if someone is Hispanic or Latino in a rural area in the Deep South, that might look very different than a Hispanic or Latino individual who is living in like Miami, Florida, for example. So it really, you have to consider the context when we talk about diversity and what that may mean. And it includes all characteristics and experiences that define each of us as individuals. And it's the broader sort of entire spectrum of primary dimensions of individual identities, including race and ethnicity, gender, age, religion, disability, and sexual orientation. And then there are additional ways of looking at diversity in terms of communication styles being different and complementary, work styles, organizational roles and levels, economic status, and geographic origin as well. And then when we get to inclusion, inclusion is the set of behaviors that encourages employees to feel value for their unique qualities and experience a sense of belonging. Inclusive diversity is a set of behaviors that promote collaboration within a diverse group. So sometimes there will be a community advisory board, for example, where we are intending to have diverse races, ethnicities, cultures, ages, and other characteristics, and there may be one representative, of a certain racial and ethnic group, for example, or LGBT, representative on that council. So that is not alone inclusion. Just wanted to emphasize that it's really the set of behaviors that continually encourages people to feel valued for their unique qualities and experience. So it's not only the intent, but it's the actions that follow is really the main point. Inclusion is also defined as the degree to which an individual perceives that he or she is an esteemed member of the group through experiencing treatment that satisfies his or her needs for belongingness and uniqueness. That's another definition for inclusion. So it's really putting things in motion to ensure that systems of care are ensuring that there's participation. And why is HR and workforce development important for systems of care? Well, to connect the dots, it's certainly a component of the core system of care values and principles. And as we are familiar with, we know that they are family-driven and youth-guided as a core system of care value and principle, that the system of care is also community-based and culturally and linguistically competent and data-informed. So these four different major aspects of system of care values and principles when we get to cultural and linguistic competence as a driving framework for that, this is why it's important for HR as well as workforce development to attune to the needs of diversity, inclusion, and health equity. So to build a culturally and linguistically competent workforce, SAMHSA's guidance on this is from one of their website pages. The text here, just referenced below, is to produce positive change, prevention practitioners and other members of the behavioral health workforce must understand the cultural context of the target community, so that it would follow that personnel, staff, and employees and other workers within the system of care would need to have cultural linguistic competence, because in order to understand the cultural context of their target community. So HR and workforce development would support that. And then they must also have the willingness and skills to work within this context. This means drawing on community-based values and customs and working with knowledgeable people from the community in all prevention efforts. So these are really, this is what SAMHSA is wanting, and wanting for services to be inclusive and ensure that, that this is the sort of practices that are used within the system of care. And so an HR and workforce development perspective would intersect with that directly to ensure that that's in place. Another major rationale for, why is it important that HR and workforce development is ensured within a system of care is that it aligns with the class standards. And the class standards are the National Standards for Culturally and Linguistically Appropriate Services, or CLAS, and they're designed to advance health equity and improve quality and help eliminate healthcare disparities. Essentially, it's a core blueprint for individuals and healthcare organizations to implement culturally and linguistically appropriate services. They're published in the updated versions of this have been evolving. There's the most recent version was April 2013. So, and I'm sure there's other updates that are on the horizon as well. And there are many resources that are available, driven from the Office of Minority Health, Think Cultural Health website, with lots of resources and trainings and other types of supports. So it's really a core component of how SAMHSA, as well as other federal agencies, are implementing their grant portfolios and services initiatives. So if we think of the class standards as a sort of roadmap depicted here, and it leads to the advancement of health equity and elimination of disparities and improved quality, the sort of circle in the lower right-hand corner. It stems from deep roots, right? So in terms of policies within the United States, within how this has been shaped and framed for decades, and it is really driven in a major part from the Civil Rights Act of 1964. So there are components that interweave with governance, leadership, and workforce development, which is a major area of the class standards, as well as communication and language assistance, in addition to CQI and accountability. So those are the intersecting points in terms of the frameworks and why this is really all hinged together. And that's another summary of the major areas for the class standards. And the intent is to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. And here's another framework in terms of outlining those major components. And for those that like the pyramid model or the triangle models, that's also available here. And so the class standards, when we get to which class standards relate to human resources and workforce development, there are three that really stand out. Really all the standards are, they have a relational component to each of the class standards. But if we wanted to highlight and sort of really zero in on which ones, there are three that definitely come to the forefront. The first is standard number 2, and that's to advance and sustain organizational governance and leadership that promotes class and health equity. through policy, practices, and allocated resources. The second standard that stands out is standard number 3, is to recruit, promote, and support a diverse governance, leadership, and workforce. And then the third major standard that stands out is to educate and train governance, leadership, and workforce in class. So taken together, these are 3 major areas of the class standards that intersect with HR and workforce development. So after we kind of think about the major frameworks, the broad macro level frameworks, how do we get this done? And so that's where we can transform those frameworks into strategies. And on the left here is depicted, what the core standard is that we're relating to. And then as we think about strategies for enacting, how do we get that done? Then we're going to discuss each one in sequence in this way. So related to standard number 2 is the strategies to invest in multicultural CLC cross-training and capacity building. So why would it be important or a good pursuit to do this? Because the rationale is that a well-trained CLC consortium or council or other type of descriptor is comprised of the SOC workforce, community leaders and partners, and youth and families. That consortium provides opportunities for fiscal growth beyond the SOC funding period. So this is important for administrators, it's important for staff, for organizational health in terms of organizations that are connected to the system of care and supporting the system of care. So we want to definitely make sure there's a well-trained CLC-related consortium, and by having that consortium in place, we would want to invest in multicultural CLC cross-training and capacity building. And I'm just kind of going to rattle off CLC over and over because it's, cultural linguistic competence is, kind of a long term, but I'll try to remember not to use acronyms, but I may default into that. I'll try to not do that. So some of the examples in terms of how this strategy is being pursued in the field and how systems of care are operationalizing this strategy is that they're developing CLC cross-training capacity building specifically for certified peer support specialists. And there are other professional titles and terms. We know that behavioral health organizations have lots of ways that staff are identified by titles and positions. They may be called recovery coaches, community health workers, any specialized professional credentials that align with the Medicaid or third-party payer sources. That's a real way that the training resources can be supported. And so within this, we see that there may be formal requirements. Lots of different state entities, for example, have a certified peer support specialist training series or options for people to come and attend a multi-day session or accumulate a number of hours for their training certification. And so they may, in terms of having someone who wants to become a certified peer support specialist, they may need to meet certain qualifications to enroll into a formal type of training resource like that. Sometimes it's by age. Maybe it's if it's working with as a peer to adults, that they would have an age requirement as an adult requirement, or if it's youth, to have a youth requirement. Education, for example, it may be trainings, previous trainings, or high school, some levels of high school, things like that. Residency requirements, hours of paid or volunteer work in a support or advisory role with adults of transition age youth diagnosed with a serious mental illness or substance use disorder. That's one example for an adult peer support specialist. Experience working in a state certified agency and program, and supervision by a mental health professional. So someone who is, basically qualified to, to be a peer for someone else. There's informal peer support and then there's the formal peer support. So this is definitely relating to, how can we have a workforce sort of professionalization of a workforce that of peers that are certified peer support specialists. And so when we have formalization of a position or a paid sort of paid titled position, then we need to have job descriptions and criteria, right, around what what that person, how they would be qualified. And we know that these specialists frequently have direct lived experience with recovery and resilience related to mental health and substance use challenges. So that's definitely a major part of being a peer and supporting someone else to, to serve as a role model and a support person and, a friend and, other types of ways that people can affiliate. That it's really important for them to, to have that direct lived experience with recovery and resilience. And investing in workforce development for these specialists can better align the cultural linguistic needs of the populations that the systems of care serve with organizational practices. And this is definitely supported by the research and professional literature. There's a model advanced by Maria Hernandez at the University of South Florida, where that you have alignment between the needs of a population that the systems of care are serving and the organizational practices. And there's one of the ways to advance the alignment within the two of those different dimensions is to ensure that there's investment in workforce development. So some concrete examples include allocating resources for staff and supervision time, transportation supports. For example, if there's a state level training maybe at the state capitol or a regional center, that there's supports that might be several miles away or 100 miles away, that there would need to be some type of mileage or other ways to support their transportation, group travel, for example, or other ways that costs can be effectively managed and used, to have volunteer development opportunities as well as curricula and materials. Maybe it's paying for registration for someone who is becoming a peer support specialist, the registration at the training, registration for professional venues, conferences, or other ways that training is being offered and available. To pursue workforce certifications and credentialing, some type of formal credentialing in terms of receipt of an evidence-based training module, for example, to educate youth and family and community leaders. The community leaders that have recovery and resilience experience and that are doing well within the community, that they would be excellent peer supports people to be part of this, this intent to ensure that they are peer support specialists within the system of care. And also to leverage no or low-cost CLC technical assistance, cultural linguistic competence TA. And this is something that the TA network can certainly support. There are lots of resources, web pages, as well as this webinar today, and then there's individual support as well. So we'll definitely, in the discussion component, if there are any specific needs that we can help with, we can address some of those and follow up with you. So the next class standard is standard number 3, and that's to recruit, promote, and support a diverse governance, leadership, and workforce. And so the connected strategy to this is to reinforce the cultural linguistic competence, CLC, within position descriptions and recruitment activities. So again, it's to formalize, what does this look like when we have a peer support specialist or people who are working on CLC specifically. We want to make sure that it's written as a sort of job expectation for them. And so that's it's not only in their sort of job description or position description, but it's also in the way that recruitment is conducted for those positions. And the reason why this is important is because developing CLC, cultural linguistic competence, and knowledge about the diverse CLC identities of populations serves as instrumental in removing barriers to services. Again, there's literature to support this. There's practice in the field. There's conferences at the training institutes earlier that took place, hosted by the University of Maryland. That this was a major topic, right? That cultural linguistic competence and knowledge about diverse CLC identities of populations. We know that it helps to remove those barriers to services, right? It's facilitation, helping with everything from enrollments to ongoing follow-up and support for youth and families. So some of these examples of how to do this in terms of updating position descriptions is to ensure that the language within those job or position descriptions is free from subtle biases, stating overtly that the behavioral health organization or the system of care entity is committed to diversity and inclusivity in the workplace, right? Having that as an actual statement it goes a long way in terms of setting up expectations. And then ensuring that there are, as well as expectations for CLC training and education, right? This is going to be part of your job, right? So this is kind of set up front, all way up front, upstream in the position description. Staff and employees don't kind of learn about it, beyond day one. It's even prior to that. And in terms of recruitment, one of the ways that this can be facilitated is to have a what to expect section on the organization's website for applicants and candidates to learn about the organization's commitment to cultural linguistic competence or diversity inclusion values, and also to evaluate how and where those open positions and descriptions are posted. So is it Indeed.com or Monster.com or sort of the main job boards only, or is there intentional placement in publications or other media where people who you're looking to reach to enhance diversity and inclusion, all right, is sort of part of what the type of media that they're exposed to. So ensuring that those are also placed in those types of environments. And it's important to make a statement that any type of job description, as we know, really you can't just kind of say that there's, we're only looking for this specific type of individual by race and gender and other types of things, because it's the U.S. Equal Opportunity Commission law basically saying you don't want to make sure that you may want to have someone specific for a position, but you have to kind of walk the line to make sure that you're not tipping over into something that could be interpreted as discrimination, right? So that's the point of sort of having this caution. In those instances where a behavioral health services organization may desire to have a specific type of person that matches the characteristics or the demographics of the community served, right? It's that they can't advertise an open position only seeking those types of specific race, ethnicity, et cetera, but they can emphasize direct experience and specific qualifications to find the best candidate. So there's equal opportunity, right, for that position, and that's the intent. So I'm going to wrap up in just about a few minutes, but I wanted to definitely cover Standard 4 as well to talk about how the strategy for educating and training governance, leadership, and workforce in class, that the way to operationalize this is to approach CLC, cultural linguistic competence education and training, as an ongoing effort compared to the one-time educational event, right? So an organization may have LGBT inclusion and diversity inclusion training, like, if it's the one time, and it's not really a one and done, right? That there's an ongoing effort for to ensure that that the lessons learned from the training are advanced, or it may be addressing other types of topics for addressing racism, right, or other types of things. So having trainings that are available for reducing biases and addressing conflict resolution, and really having cultural linguistic competence at the forefront, but there's an ongoing dialogue and ongoing formality to ensuring that those types of things are in place and available. And the Harvard Business Review supports this. They note that awareness building and skill building training efforts, when conducted over a long period of time, they have the greatest effect on the climate, or the cultural climate of an organization. And just to provide a quick example of how we ensure that CLC training has certain outcomes to it within a system of care. When a system of care does a CLC training, for example, by a peer support specialist or by somebody who's providing local train-the-trainer types of resources, one ideal to have is to ensure that the learning objectives of the training are being met. So there could be a rating scale for the before and after sort of commitment or familiarity with the topics, comfort levels with the CLC related topics, so that one way to look at this is to kind of look at it before and after perspective to see if we were able to move the needle or move the wave over from across that scale from not at all to completely. And then another way to do that is to have qualitative responses, and these are examples of literal things that people have written in about how the CLC training sessions helped them and how they can better help others. So another major item for another strategy is to incorporate CLC into performance evaluations and exit interviews. And the reason why this is important is because building a CLC component into the expectations addressed in the performance review and exit interviews can offer support to system of care leaders as well as the employees who take part in the reviews and interviews. So one of the ways to do this, how do we go about putting it into our performance evaluation and exit interviews? Well, organizational system of care leaders can communicate those expectations of the cultural linguistic competence clearly and often to employees before the formal review process begins, to be a model for inclusive behaviors, to learn by taking part in capacity building activities alongside employees. This is having leadership at the table, and also by gathering information on employees' performance through observation and by collecting feedback. So those are some methods, specific methods for how to address those items. And then employees can be given the opportunity to highlight CLC learning experiences that they've taken part in, reflect upon their growth and outcomes, and set goals for future development. So that's really the intent is professional development, is to really have these positive aspects of what types of things have been gained. And these are some prompt questions that are optional for anyone who wants to sort of fold that component into exit interviews as well as performance evaluations, to ask things like, in what ways have you participated in cultural linguistic competence capacity building activities during whatever, if it's a 3-month evaluation period or if it's an annual review, or and what have you learned? Have you had the opportunity to apply your learning in the workplace, right? And other types of reflective questions. And another major strategy is to communicate cultural linguistic competence and class standards achievements, right? That it's not a negative perspective on, oh, this isn't, we want to just focus on what we're not doing, or problems or challenges or negatives. It's really about ensuring that, that there's a celebration of achievements with stakeholders to serve as a model, right? We all want to look at successes together. So one of the ways that this can be done is by recognizing staff for excellence, giving kudos both individually and in a group-based setting, staff meetings, right, performance evaluation meetings, right, ensuring that those are definitely stated and as well as documented, to promote achievements on the organization's website. Right, that would be another way that the organization can show that they're committed to this, as well as using website promotion as an opportunity to share resources and best practices. So this is really about sharing information in a more public way with the system of care partners. Okay, well, I'm going to hand it right over to Jane, and thank you so much for connecting today, and we'll circle back around for our Q&A.
Okay, good afternoon, everyone. I'm Jane Flournoy from the Colorado Office of Behavioral Health, and really what I'm going to share with you today are some examples of what we've done to hopefully help our behavioral health agencies statewide have a better understanding of what can be done to operationalize the national class standards. And so what you see here in front of you is the result of about 1.5 years of work in which we convened a policy work group comprised of individuals from our statewide Cultural Competency Advisory Council, as well as individuals from each of our state-operated mental health institutes. And so when we convened this group, we really were trying to figure out ways in which we could develop policies to support our providers. And so it seemed to make the most sense to really build off of the national class standards. And so one of the things that we found in terms of feedback from providers was, yes, we have these standards. Yes, certainly we want to strive to work within this set of standards. However, we're really struggling with what it is we can do to best organize ourselves and adhere to them. So what we did is we decided that our policies were going to be reflective of, one, the principal overarching standard within the class standards, and then subsequent policies reflective of standards 2 through 4, which are the governance, leadership, and workforce standards, standards 5 through 8, which are language and communication access and assistance, and then standards 9 through 15, which really focus on continuous quality improvement and accountability efforts. And so for our purposes today, one of the standards, or one of the policies that I want to go over, is the policy that we developed related to governance, leadership, and workforce. And so within this particular policy, you see that the overarching goal is that our agencies engage in organizational governance and leadership activities that really help to promote culturally and linguistically appropriate services and ultimately, for our purposes, behavioral health equity. So within our policy, we've really outlined some of the things that Peter previously mentioned. So we outlined that the expectation is that providers would weave culture and diversity and areas of focus in terms of competency on those areas into all aspects of hiring and supervision and evaluation of employees. So our policy outlines that the expectation would be that within a job posting, there would be a mention of what the expectations are in terms of a potential employee's competencies or experience related to serving a diverse population of clients, and then within the hiring process, there would be questions within an interview related to what are your values around culture and diversity? What's your experience in serving diverse populations? What previous training or education have you had around things like implicit bias, modern day prejudice, historical trauma, things related to culture and diversity? How would you apply that to this new professional role? And then following hiring of an individual or a number of individuals, the expectation outlined within the policy would be that the agency would continually focus on cultural responsiveness within supervision, so administrative supervision, clinical supervision, really taking a look at how our individual staff allocating time and resources and energy to a diverse caseload of clients. Is there anything that they're noticing in terms of themes with how someone devotes time, resources, and energy to particular clients, and really trying to ensure that the skills that are learned and the expectations around someone's performance really promote the idea that the ways in which someone is conducting themselves on the job is promoting equity in terms of who has access to services, who they're retaining in services, and ultimately what the outcomes are. And then, I'll stay on that one slide. And then with that, and in keeping with standards 2 through 4, within this OBH policy, there's an expectation that an agency will work to train its workforce on an ongoing basis. So the expectation would be that the agency is making concerted efforts to provide training related to culture and diversity to its workforce on a regular basis, and regular meaning it could be annually, it could be quarterly. The policy outlines that it would be up to the agency to decide what that regular basis would really mean. So one of the other policies that I wanted to be sure to make a mention of within this training is a policy that we've developed outlining that, one, our state-operated mental health institutes each have a cultural competency committee, but two, we wanted to make sure that these committees had a very clear sense of what the expectations were in terms of how they organized themselves and then the activities that they were expected to carry out. It's very often that I hear from agencies that they may decide that they want to start up a cultural competency committee or work group or task force or coalition, kind of fill in the blank on how those different meetings are labeled. But what I end up hearing very often is that these groups will be convened, and then the groups really struggle with what it is they want to accomplish. So very often groups will say, we organized ourselves, we developed a group, and then we really focused on how do we as a committee want to define terms like culture, cultural competency, diversity, equity, and then following that organization and the development of those committee or group specific definitions, there's really a struggle on where do we go from here. So that's what this policy is specifically designed to address. So what we've outlined is that for our institute committees, each of these committees would have multidisciplinary membership that are really reflective of the services offered. So we would have individuals representative of our medical teams, our behavioral health teams, our direct client care teams, and then our leadership teams. And so the idea was that we would have membership from various levels of management as well, aside from these different work units. And then we also wanted the group to structure themselves in terms of identifying a chair, a co-chair, a secretary, and then organizing themselves in such a way that individuals who are participating would be term limited. And that's really to ensure that we not only have our early adopters, folks who would naturally be drawn to a committee such as this, but that we allow for individuals from different work units to really take turns in participating, so that over time we've cast a broader net in terms of which staff are involved and committed to these efforts. Certainly we've outlined that we would want these committees to develop a mission statement, but then in terms of their responsibilities, we listed a number of different items. So I'll move forward here in the slide. So you can see items A through D here. One, we've identified that this committee would be responsible for identifying and facilitating coordinated trainings for the staff at each of the institutes, so that this committee would have ownership of what types of trainings would be provided, how often trainings would be provided, and really take ownership of what that process would look like and what the identified areas for training would be. Also, we identified that these committees would be responsible for conducting a periodic agency assessment, utilizing a tool that focuses on organizational assessment of culture and diversity. So one of the ones that we outlined as a suggestion was the National Center for Cultural Competence's Cultural and Linguistic Competency Policy Assessment, the CLCPA. So that's one we suggested, but certainly we've left it open that if our institutes, if those committees find an assessment that they think might yield more valuable or applicable information, that they're free to do that as well. And then from those assessment findings, they would then potentially organize future efforts around, maybe we want to focus on this in terms of our policy development and revision, maybe we want to focus on these topics related to training. So the intention is that they are regularly assessing for areas of growth related to behavioral health equity. The third item is developing and maintaining and updating an annual equity plan. So this would require that they dig into some of their data related to client demographics so that they can best understand ways in which they are currently serving their population, identify any areas in which they recognize disparities or the potential for disparities, and then develop a plan with actionable items that they can work on throughout the year. And for both of our mental health institutes, within the state. They're both hospitals, and so certainly we wanted to incorporate that this equity plan would not only meet our requirements, but would also meet requirements outlined by CMS, the Center for Medicare and Medicaid Services. And then certainly tracking length of stay for limited English proficiency individuals so that they could detect whether or not there were any disparities with whether clients were being held longer than their English-speaking counterparts, and would that potentially be indicative of any issues related to communication needs and meeting those needs. These next items are that these committees are responsible for reviewing consumer requests and complaints that have a basis in culture, diversity, and/or individual rights. That they review consumer satisfaction surveys to monitor for any concerns that would be culturally significant or relevant. And then ultimately be able to track that information and compile potentially a report or at least a sense of trends in terms of anything that might be culturally significant related to consumer complaints and satisfaction surveys. Additionally, staff would be able to submit any concerns or complaints that they have in terms of agency operations related to being culturally responsive. And then these committees are also responsible for reviewing institute-specific policies to ensure adherence to any and all applicable standards, specifically the class standards and any laws that might apply to being culturally responsive and really making sure to focus on individual rights. Lastly, and I had mentioned this related to the workforce governance and training policy, a focus on cultural and linguistic competency in ongoing supervision practices. So again, this was really designed to help agencies and not only our own institute committees, but serve as a model for our community-based agencies if they're struggling with how to organize themselves around having a cultural competency committee, that this is something that they could potentially look to as an example or as a potential template. Some additional examples of our other policies are a few that I'll make a mention of. Certainly we have a policy related to individual rights and cultural considerations. So this outlines, again, the need for really focusing on the complaint process within an agency and the grievance process and how agencies respond to those, especially when there's a cultural context to those complaints or concerns. Language access and effective communication. This is a policy we developed to ensure that agencies have an understanding of really what it is the expectations are to be able to provide services in an individual's primary language spoken and or preferred language spoken. And within that policy, we really wanted to outline some prohibited activities to make sure that folks had what they needed in terms of language access. And then you can see there's a couple more. We outlined gender identity considerations, specifically for our residential programs. And then lastly, the policy I mentioned earlier on reflective of standards 9 through 15 within the class standards, activities agencies can do to collect data and then understand their data to inform their cultural competency efforts. So that, I think, concludes my slides. And so well, we've got one more, but just a few quick lessons learned and recommendations, and these are things that I think that we've mentioned in previous slides, that we really want to be mindful about how we weave this information through hiring practices, supervision and evaluation of staff, and then ultimately monitoring for how it's impacting client care. So I will go ahead and turn it over to our next presenter.
Great, thank you so much, Jane. This is Shannon Moreno. I'm the Cultural and Linguistic Competence Specialist with Texas System of Care, and I just wanted to, similar to Jane's presentation on things going on in Colorado, just wanted to share a few examples from Texas. So we definitely try in Texas to pay attention to workforce training for different service sites, and this is particularly important in our state, which is very, very large. We have vast rural areas, and we also have really, really major differences across the states as far as culture, languages that are spoken. There's a wide variety across the communities that we see in the border regions along the U.S.-Mexico border versus up north in the panhandle of Texas versus East Texas, West Texas, our major cities, Houston, Dallas, Austin, San Antonio. We have counties with an entire population of about 500 people. There's just a really, really wide variety across the different communities that we see in Texas, but it's all within the same state. And so we also have situations where children who are in out-of-home placements, whether it's because of involvement with the juvenile justice system or child welfare system or placement in a residential treatment center, we sometimes have children who are placed not only out of their homes and local communities, but extremely far away geographically from home and from the local culture of their specific community in Texas. Sometimes children are placed so far away from home that it's more practical to take an airplane to reach the new placement. And so we really struggle, particularly in some of our rural areas that do have some of the out-of-home placement situations taking place. Rural areas with a majority white populations where there's a disproportionate number of children from racial ethnic minority groups, and the professionals, whether it's juvenile justice professionals, child welfare, the behavioral health professionals, don't have familiarity working with youth of color, period, but also don't have day-to-day interactions with the cultural context of the local community that the children and youth are coming from, who they are serving. So this is a major issue across the board, of course, but we tend to see these issues even exacerbated just by the large geographical areas that we have here in Texas. So one attempt to approach this issue is the Texas Health and Human Services Commission has recently hired a specialist to take a look at all of the different workforce issues that we have, specifically in our behavioral health system in the state of Texas, and this includes but is not limited to this issue of having cultural clashes oftentimes take place between the youth who are served and the professionals who are providing the services. But there's also a general shortage of professionals in a lot of our areas in Texas. Also taking a look at the workforce before it becomes the workforce, so trying to improve in the local colleges and universities that we have in Texas the training of professionals before they actually enter into the field. And this includes having local organizations, encouraging them to partner with colleges and universities that may be within their catchment area or close to the catchment area, including some of the HBCUs that we have here in Texas. So just to further emphasize some of the workforce shortage issues that we have, this is from the Department of State Health Services here in Texas. And all of the counties, we have in Texas about 254 counties, and the vast majority of them don't have a psychiatrist, period, let alone a child psychiatrist, which the situation for that looks even worse. So we have a major workforce shortage across the board. This is not only in regards to psychiatrists, but many, many counties don't have providers or have very, very few providers to meet the needs that are in their local catchment area. And then looking at that issue even further, in addition to there being a shortage of professionals, including but not limited to psychiatrists, the racial ethnic makeup of the different population or professionals that are serving folks definitely does not overall reflect the population of Texas. Texas is a minority-majority state. We have more racial ethnic minorities living in the state of Texas than we do white individuals, and yet across the board, all across the state, there tends to be more representation of white individuals in these professional spaces. And of course, this has ramifications not only in regards to the one-on-one services, but also in regards to the overall culture within professional organizations, within healthcare organizations that are serving our children and our youth. So in addition to looking at the actual workforce issue, another approach that the Texas Health and Human Services Commission has taken is really trying to provide more support behind the Behavioral Health Services Cultural Competence Work Group. This work group has increasingly more and more gotten support from leadership to have things actually happen. Jane mentioned in her presentation, certainly something that we tend to see, that different committees or work groups may come together, but then either struggle with where to go from there, or one situation that we were previously seeing with this work group in particular, that there wasn't necessarily decision makers at the table, or a lot of support from leadership for groups to really move forward with initiatives. So this work group in particular is getting a lot more support from leadership. They develop a charter, and in it they identify about 2 to 3 major goals, and essentially the work group just works at those hard and then develops a completely new charter once those goals are attained. And the high-level purpose is to advance class within the state's Behavioral Health Services Division. They've done things like going through and doing contract reviews and making changes to the actual service contracts that goes out with the local mental health authorities across the state to make changes and align those contracts with the class standards. They have made an impact in the way that the state is now collecting data across the board and taking a look at utilizing that data. A number of different things that have made a pretty significant impact. Overall, the work group tries to review the activities and propose changes at the state level. And then also the work group works in collaboration with the Texas Council of Community Centers. And what that is that all of the behavioral health community centers across the state of Texas are able to give input to various activities at the state level to make sure that it's not just a matter of mandates coming down from the Health and Human Services Commission that isn't going to work across the board, because as I mentioned before, there's a lot of variety, a lot of diversity across our state, and the different communities look very different and function very differently. But this Texas Council of Community Centers allows for at the community level for there to be feedback and input at the state level. And so this work group makes sure to work closely with that council to ensure that the intentions of making these changes, for example, language changes in the contracts, are actually going to do something when it gets down to at the community level and are going to have a positive impact. Another thing in Texas is the Texas Office of Minority Health Statistics and Engagement created an online training over the class standards. It explains class through an integrated care lens, so this has been really utilized a lot by FQHCs across the state, as well as providers from both the primary care and behavioral health care settings. It does offer CEUs for a variety of different licensed professionals, including community health workers. It's really been taking advantage a lot along the border regions with some of the promotoras, as well as peer providers across the state are also able to obtain continuing education credits for this. A few other professionals that are not listed include dentists. A number of professionals are available to get CEU credit for this. And the online training essentially introduces health equity, defines disproportionality and disparity, gives real-life examples, utilizing data specific to Texas, and then it walks through different scenarios of utilization of the class standards of all 15 of the standards that Peter went through before. So that's a training that we have been able to advance quite a bit in Texas, and have had To date, this training has been available for a total of about 7 years or so, and about, the last number that I was aware of was about 6,500 or so professionals had taken this online training to expand knowledge and understanding about the class standards. And then specifically for Texas System of Care, where we provide training and technical assistance to the local system of care communities across the state, one event that we are very, very excited about that is going to take place this summer is we are going to be holding a class policy academy. We are going to have 5 community sites attend, and each community site is going to send a team of 7 people with specific roles. So there's going to be, for example, a young person in attendance from each local community, a family member in attendance from each local community, data specialists, the system of care project manager, and so on and so forth. We have, defined specifically who we want to have at the table from each of the community sites so that there can be beneficial inclusion of various voices and perspectives during this time. It's going to be a 1.5-day event, and the overall goal is that each community during the process of this academy is going to come away. Each team will have an actual health equity plan that they will be then taking next steps to utilize and implement within their local system of care community. During the academy, we're going to focus on quality over quantity, so we're not going to focus on each of the 15 standards, but each community team is going to be led through an interactive activity to choose about 2 or 3 standards to really sit down and hammer out to very molecular level, so to speak, what a plan of action is going to be to implement that specific component of a standard in their local community when they go back home. And of course the goal is to address disparities by population and region, so we are also doing some technical assistance both before and after this event, which includes helping sites to understand their local community, to take a look at their data, and make sure that, again, when they are selecting before the academy itself, when they're selecting team members, that they have the right folks at the table to try to make a dent in some of the issues in the local community. And I'm seeing a question come through asking about youth and families participation, if we offer stipends. Yes, stipends are going to be offered. The community sites that are going to be attending, that they have actual system of care dollars, whether that's through a Texas Health and Human Service Commission grant or directly a grant that they receive from SAMHSA, they're, being encouraged / told really that they'll need to utilize some of those dollars to offer stipends for the youth and families. And then other community sites that are practicing the approach to system of care but don't necessarily have current system of care funding, we at Texas System of Care are going to pay for those sites which went through an application process to be accepted to the academy, and the youth and family members of the teams that they're sending, we will also be providing a stipend for those folks. So thank you, Miriam, for that question. And that's all that I had for examples from Texas, so I will send it back to Peter.
Wow, well, many, many thanks to both of you for the really impressive cultural linguistic competence work that both accomplished and with your system of care community champions. And it's amazing. We know there's a lot of work with structuring and setting up policies and procedures, just having them documented and outlined, but there's also the ongoing guidance for implementation and follow-up. So, big celebration of, the work that you've both done. It's really incredible. We just wanted to also provide a resource for equal opportunity, equal employment opportunity and non-discrimination protections. I'm not going to run through the specifics of each of these, but these are available within the PowerPoint. But I definitely want to move us to our, our opportunity for us to have our question and answer dialogue. But just to make a quick point that, we know that there are differing federal and state and local laws and policies governing employment protections for employees in the United States, all kinds of different, non-discrimination differences and similarities as well as they relate to race, ethnicity, gender identity, sexual orientation, health status, right, or other characteristics that may be specifically or not specifically outlined within certain policies. But it's really important to know about the big ones, right? So the Equal Pay Act of 1963, and again, I'm not going to run through each of these for the sake of time, but these are really the major touchstones in terms of guiding employment protections across the United States. The Civil Rights Act, of course, of 1964. The Pregnancy Discrimination Act, which was an amendment to the Civil Rights Act. The Age Discrimination in Employment Act of 1967. The Rehabilitation Act of 1973, and then the ADA of 1990. So I'm going to just kind of, and a more recent one is the Genetic Information Non-Discrimination Act of 2008. So again, those are just to kind of provide the outline for, the major protections that are really enshrined within the policies of across the United States. And then state laws may have specific, additional protections around things like military and veteran status, or the criminal record, or marital status, gender identity, and sexual orientation. So just to state that, we know that those are definitely guidance frameworks that are there from the federal and the state level and the local level, cities, counties, and other municipalities. The National Conference of State Legislatures has a really excellent resource for system care professionals to learn more about those types of policies. So I'm going to move on to, these are the references, and I'm going to leave this slide up, but I definitely wanted to open up the lines, and we can talk about any specific experiences that you have that you would like to share with the group, and then we can identify other topics of interest for you. Okay, so I think all the lines are unmuted at this time, but I'm not quite sure. All right. Well, I want to just definitely open up the opportunity for dialogue, and we can share other experiences that we have as well, for things that are going on in the field in terms of how policies are being implemented, the types of, let's say, not challenges, but maybe opportunities that have come up in terms of overcoming barriers, or any other lessons learned. Would anyone like to share? Okay. Well, I think it's maybe a quiet group, and again, it's Thursday afternoon, so that was definitely a lot of rich sources of information that we covered today. And if people don't have comments, you can certainly follow up with us individually if there's anything specifically that we can help with. If there's any TA-related needs that you have, we're happy to set up individual TA call with you. And then we have resources available online as well related to this. And I think that the registrants, I'm assuming that the registrants of this webinar will get the sort of follow-up communication around the availability of the recording or other types of resources. Okay, and I just want to make sure that everyone knows about the survey that's available in the chat box. We really appreciate your feedback, and it helps to inform how we develop these resources for you. So we definitely want to wish you the best in terms of follow-up, and look forward to connecting with you again. Thank you so much.
Thank you. Thank you.
Take care, everyone.
Thanks, everyone. Bye-bye.
Thank you, everybody.